Hi everybody, my name is Sarah and I'm just making this video to tell about my journey having a total thyroidectomy and having my thyroid removed, just to put more information out there. I'm getting ready to have my thyroidectomy here in about 3 days on Wednesday, and I'm getting nervous about it, but I just really wanted to make this video beforehand. And then I'm planning on making a few more videos just to kind of document everything that happens to me. Whenever I was out doing research and stuff about me having this procedure, I really appreciated the people that put out videos, and there really just aren't a whole lot. So that's why I decided to go ahead and put mine out there too. And also, just, searching around the internet and stuff, I have been really scared. There's a lot of misinformation, a lot of horror stories out there, and so I just wanted to kind of add my voice into it as well and give like a true documentation of what really happens to me, and in hopes that it will help somebody else out there. So I guess my journey started back at the end of actually 2012. It is. I went for my annual exam with my gynecologist, and part of the exam is where they feel your neck, and she told me that I had an enlarged thyroid, and I had absolutely no idea whatsoever that this was going on. No clue. Never felt it, never had any signs or anything that my thyroid would be enlarged. Like, I never had any thyroid related problems that I was aware of. And so when she told me that, that was pretty shocking. And right after that, I actually ended up losing my insurance for about 6 months, so I wasn't able to follow up on it. But eventually, about the middle of 2013, I finally was able to follow up and went to first ear, nose, and throat doctor. I had done some research, and a lot of sites and stuff said, enlarged thyroid isn't necessarily all that abnormal. A lot of people get it, and sometimes it's not even necessary to go to an endocrinologist. An ear, nose, and throat doctor can, do the necessary tests and stuff to basically clear it and, say everything's fine. So I went to an ear, nose, and throat doctor. He sent me for a biopsy and ultrasound and all that stuff. And when we got the biopsy back, he actually told me that I had multiple nodules on the right side of my thyroid, and one of them specifically came back looking really suspicious. And after testing it, it came back. Basically, they couldn't tell me yes or no, but it came back as suspicious. So from there, I was really disappointed. Of course, I didn't want to hear that. So, and also wanting a second opinion, because any of you guys out there that have had experience with the medical field know, it's always good to get a second opinion. So at that point, I ended up going ahead and getting an appointment with an endocrinologist, and he basically kind of looked at all the test results I already had. He didn't send me back for another test, and told me that I should go ahead and get my thyroid removed. So I continued to do more research, all this stuff, and I didn't feel confident with the only diagnosis I had was a suspicious nodule. To me, any of you guys out there that have had thyroid issues, thyroid cancer, anything like that, know how much the thyroid controls. So I was really hesitant at getting it taken out, especially with such an ambiguous type of basically diagnosis. Like, they couldn't tell me yes or no. They couldn't tell me a percentage, or didn't tell me a percentage. And so I just really felt like it wasn't a good enough answer for me to proceed with having my thyroid taken out, being on medication for the rest of my life, and um, all that stuff. So sorry guys, I had to stop for just a second. So anyways, after that, I basically convinced my endocrinologist that I wanted to wait 6 months and follow up again. So he wasn't very fond of that idea, but he did allow me to do that. And from there, I decided to go to a naturopath and see if the natural type of medicine, if there was any way that I could possibly heal it without having to get surgery. I know a lot of people think natural medicine is really woo-woo, but I've had a lot of good experience with it, so I just really thought that that was a path I wanted to pursue before having to deal with having no thyroid for the rest of my life. So I went to a naturopath and we did a bunch of different herbal remedies. I went and got vitamin C infusions, took some other types of medication, and basically I went back to the endocrinologist at 6 months and he tested me, and my goiter, I also had a goiter around the thyroid, including I had nodules and a goiter. So when I went back, my goiter was actually gone. We had managed to make my goiter go away, and the actual nodule itself had reduced by about 50%. So we did do something to my thyroid. However, on my follow-up test, we saw that there were at least one lymph node on the right-hand side that was also getting involved. And so at that point, it looked like it had probably been basically metastasizing and moving into the lymph nodes, which is really, really common with thyroid cancer. Okay, sorry about that again. My boyfriend actually ended up walking in right when I was doing my video. He didn't know I was doing this. So anyways, basically we found out that some lymph nodes were involved, which kind of convinced me more that it was probably cancerous, and the suspicious diagnosis was probably correct as far as it being cancerous. But I really, really was disappointed in them not being able to give me more of a definite answer. And I was really, I've been pretty resistant about getting my thyroid removed up to this point, just because of all the side effects and stuff that you have to deal with after having no thyroid. So I went back and did one final biopsy. We did it on the thyroid again, and I also had a lymph node tested. And once again, results came back exactly the same. It was just suspicious, and at this point I realized that I was hoping to have more of an answer, but I realized at this point that the doctors and stuff are probably they're not going to give you a definite answer. They're, as far as, liability purposes, they don't want to tell somebody that they have cancer and then go in, take it out, and then they don't have cancer. So at this point, I kind of just realized, all right, well, I got to just take all the evidence that I have and proceed forward with the best way that I know how. So basically all of my doctors, including my naturopath now, are all on board that me going ahead and having my thyroid taken out is the best course of action at this point. Like I said, my surgery is in about 3 days, and I am getting rather nervous about it. I have had some other surgeries before, so this isn't like the first time I'm going to be under anesthesia or anything like that, but it's such a big procedure. Also, with lymph nodes being involved, it has made mine into a what is it called? It's some kind of neck dissection. So basically what they're going to do is they're going to do a cut here to take out my thyroid, and then they're also going to come over to the right side of my neck and do a cut here, and they're going to take all of the lymph nodes out on the right side. So basically everything from my thyroid over and down to this chest area. I had a CAT scan. The CAT scan didn't show anything as far as being in my chest area, which it can move down there as well into those lymph nodes. So I'm happy about that, but it's still going to be about a 5 or 6 hour surgery, which is definitely the longest surgery I've ever had. So anyways, I do have some pretty good experienced doctors, which that is one thing everybody should research. And before you go and get your thyroid taken out, make sure that you do have a doctor that has a lot of experience in it, because it is such a sensitive gland. And there's also some parathyroid glands, which are on the back of your thyroid, which they try their best to leave at least 1 or 2 of those in. You have 4 of them on the back of your thyroid. And they try to leave at least 1 or 2 of them in, because those are what regulate your calcium and your vitamin D in your body. And if they take them all out, then you're probably going to be on, well, not probably, you will be on calcium and vitamin D supplements for the rest of your life, along with your thyroid medication. So, you know, it's just really important to have a good surgeon that knows what they're doing. And then I actually have 2 surgeons, and the second surgeon specializes in removal of lymph nodes. So at least as far as my surgery goes, I have a good medical team behind me. So just whenever you guys are doing this, make sure that you do research and make sure you get a really good experienced surgeon. Like I already said, it's such an important thing, and you really don't want them to mess up in that area, just because it can affect your voice. You know, a rare side effect is that you can have a hoarse voice for the rest of your life. Most people will have a hoarse voice for at least a little bit, but if it affects your vocal cords, then you can be hoarse forever, which, you know, nobody wants to deal with that for the rest of their life. As well as there are some nerves, specifically in mine, because they are doing I remember what it's called, lateral neck dissection. Anyway, since they're doing the lateral neck dissection on me, which includes this cut over here, there's a few more nerves. Like there's one that leads to my face that can make my face droopy. There's one that leads to my shoulder that can make my shoulder droopy. And you know, if they damage any of that stuff, then you're going to have to deal with that for the rest of your life too. So I did my research on my surgeons to make sure that I had some good ones. So that's where I'm at basically now, is I'm getting ready to have my surgery. And so this is just part 1, and like I said, I'm going to do some more videos out there afterwards, trying to document what else I have to go through. I will also have to go through radioactive iodine treatment, as long as it comes back as a positive for cancer, which at this point we're pretty sure it will. And I am going to be 30 in about 2 weeks, by the way, just so you kind of know my age and all this stuff. And I've been dealing with this at least for about 1.5 to 2 years. So they found it in the enlarged thyroid at around age 28. So anyways, just to kind of give you an idea of where I am at my life. And so yeah, so I'll go ahead and post another video later and give you updates after my surgery, how it went, what kind of side effects I'm having, if any, and all that stuff, so you guys can kind of be prepared and know what to expect. So thanks for listening, and if you have any questions or any, you know, encouragement or anything like that, you're welcome to leave comments below my video, and I'll really appreciate any feedback that you can give, and I'll be happy to answer any questions anybody has, because I know this is really scary and frustrating and not something that you know, want to have to deal with. But I understand I'm there, so, you know, happy to help if I can. And I guess that's all for now, so I will talk to you guys later. Bye.